Namaste. Good afternoon. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. In my pursuit of addressing, promoting, and propagating Ayurveda and psychotherapy globally, I discuss various topics related to Ayurveda, psychotherapy, mental health thrice a week. So, today's session is a continuation session on generalized anxiety disorder that we discussed in the last session, day before. And in that session, we had discussed what is generalized anxiety disorder, what is normal level of anxiety, and what is generalized anxiety disorder, what causes generalized anxiety disorder, what are the symptoms, and the full cycle of GAD. So today we are going to discuss GAD management. That is how are we managing generalized anxiety disorder. So let's get started without wasting any time. So generalized anxiety disorder, just this is for just a recap for individuals, for people who missed the last session. So you can check the last session. The links will be given in the description. Thank you. So generalized anxiety disorder, as we have already discussed, is a mental health condition. It is characterized by excessive and persistent worry, which we call as anxiety, about various aspects of life, whatever it may be, whether it is professional, whether it is personal, and that is even when there is no or little reason to be concerned. There is no specific reason to be concerned. That means the worry, the excessive and the persistent worry, is irrational, it is not rational. So, last week we had discussed the full cycle of, in the last session, we have discussed the full session of, the full cycle of GAD. So, I'll just, for the recap, before going to the management, see onset and triggers. So, what happens is, in generalized anxiety disorder, typically develops gradually. This is a gradual development, and it can be triggered by the anxiety can be triggered by various factors. It might be stressful life events, it may be family history of anxiety disorders, or it may be a combination of biological, psychological, and environmental factors. So next is when, after the onset and the triggers, symptoms. The symptoms of generalized anxiety disorder can vary from person to person, but common manifestations, what are the common manifestation is excessive worry, restlessness, difficulty concentrating, irritability, muscle tension, sleep disturbances, physical symptoms like headaches, or even it might have gut imbalances, that is stomach aches or abdominal pains or nausea, etc. And it impacts the daily life. What is the major issue here in GAD that clients with GAD have is, GAD can significantly impair an individual's ability to function in daily life, affecting their work, affecting their school, affecting their relationships, and affecting the overall well-being. So, diagnosis. Then comes the diagnosis. So, to diagnose generalized anxiety disorder, a mental health professional, a psychotherapist, or a psychiatrist will conduct a comprehensive evaluation considering the individual's symptoms, medical history, and underlying conditions. So, then after the diagnosis comes the treatment and management. Management of GAD involves a multifaceted approach. So, we do multiple things in treating when we treat generalized anxiety disorder. It often includes therapy. Therapy is the best therapy for anxiety. You in practice is CBT, that is cognitive behavioral therapy, is commonly used to help. CBT is commonly used to help individuals identify and change negative thought patterns and develop coping strategies. So next, after therapy, people may use medications. So antidepressants and anti-anxiety medications may be prescribed. So I don't prefer using medications. So medications, will skip the medication part. If you go to a psychiatrist, maybe they might prescribe for, intensity. The depending on the intensity of the anxiety, medications may be prescribed. Definitely we go for lifestyle changes, that is encouraging, exercises, eating healthy. These are all the common things, like stress management techniques, and majorly sufficient sleep. Sleep is most importantly affected in people having anxiety. So sufficient sleep can contribute to symptom reduction. So next is support network, and what we do is, tell them to build a strong support network of friends, family, support groups. So what I talked about is the full cycle of GAD. What happens is the onset and triggers, the symptoms, and what is the impact on daily life, the diagnosis, the treatment, the therapy, the lifestyle changes, the support network. So this is in brief of what is the full cycle of anxiety. I will also explain this cycle with case studies. Before that, we will see in detail what could be the management of generalized anxiety disorder. See, the management of GAD often involves a combination of psychotherapy. Psychotherapy means talk therapy or other techniques to help individuals cope with their anxiety. So the important techniques are, as I said, cognitive behavioral therapy. The best therapy is CBT. Cognitive behavioral therapy is one of the most widely used and evidence-based therapies for GAD. It focuses on identifying and challenging negative thought patterns. So first it identifies what it does, it focuses on identifying and challenging whatever the negative thought patterns are there. First we focus on identifying it, then challenging it, and then replacing them with more balanced and realistic thoughts. So we are replacing worry with other positive thoughts and actions. So realistic, with realism or realistic approach. So this helps individual gain a better perspective on their worries and reduces their anxiety. So what we do is, in that, majorly is the exposure therapy. So, exposure therapy, as the name itself suggests, you are exposing them to the worry or the fear, whatever they have. This techniques involves gradually and safely exposing individuals to their anxiety triggers in a controlled environment. Over time, repeated exposure helps desensitize them to the fear and anxiety associated with those triggers. We are going to identify the triggers. See, suppose a person is very anxious about his or her personal professional life. So we'll identify the trigger there, whatever the trigger is. Why is he so anxious? And what we do is, we gradually expose him or her to that trigger. I will explain it in the case study. This is just a brief. So we will expose him or her to that trigger. So when the person is frequently exposed to the fear, even in general as well, if you have a fear of, most people, some of people might be, claustrophobic, some might have fear of heights, even some people have difficulty in water phobia and all. So um, people have different types of fear. This is not about the anxiety, but in general as well. Exposure therapy, by exposing them to the fear gradually by ladder, step by step, they will get rid of the fear gradually, they will be desensitized. So we do this exercise, this is important, this is called exposure therapy. And then we teach them mindfulness and relaxation techniques. Mindfulness practices such as meditation, deep breathing exercises can help individuals become more aware of their thoughts and emotions. These, meditation and deep breathing exercises can help individuals become more aware of their thoughts and emotions without, judgment. Relaxation techniques can calm the mind and the body, reducing all overall anxiety levels. So, next is the mindfulness and the relaxation techniques. So, next is the next therapy is acceptance and commitment therapy. ACT, we call it as ACT, ACT. So, what ACT does is ACT encourages individuals to accept their anxious thoughts and feelings while focusing on living a meaningful life according to their values. See what it does, it helps individuals develop psychological flexibility and reduces their struggle with anxiety. So, ACT encourages individuals to accept their anxious thoughts and feelings while focusing on living a meaningful life. The aim here is to reduce the worry, reduce the anxiety, and the trigger causing anxiety here. So next is problem solving therapy. So there is a therapy called problem solving therapy. This approach involves teaching individuals systematic problem solving skills to address the issues contributing to their anxiety. By breaking down problems and finding constructive solutions, individuals can feel more in control and reduce worry. So what it does is the problem solving, we teach there are some problem solving skills, according to the individual needs. Again, this is customized, it is different for different individuals, different for different mental health disorder. So, this addresses the issues contributing to their anxiety. So, the problem solving skills to address, the issues contributing to their anxiety, and to break down the problems into, to fragment the problems and finding constructive solutions, so that what can be done if the, anxiety and the worry is somewhat rational, at least if it's somewhat rational, so finding constructive solutions, and to feel, to make them feel that they are in their control, their anxiety is in their control, and to reduce the worry. So next is important is, I have talked it many a times, social support and communication skills. See, engaging with a social support system, there are so many support groups, having the similar issues, maybe what you are facing, maybe what they are facing, and the group therapies are given, and they're made to sit and they're made to share their experiences and how they are coping with it. And the coping strategies are provided, in general for all, so that everybody, one, they can embrace each other's journey, so that they don't feel isolated. So, because to reduce the feelings of isolation and improve coping mechanisms. So, this. And next is, as I already said, adopting a healthy lifestyle with exercise, nutrition, sufficient sleep can have, positive effects on anxiety levels. The all these treatment, act differently in different individuals. So one may benefit with therapy, one may benefit with lifestyle changes, so one may benefit with mindfulness exercises, one may benefit with exposure therapy. This is different to different individuals. It is always customizable, so it is not one treatment fits all approach. It is different for different people. Next is, if there is any stress management techniques, and all these are done. So in all these conditions, no, it is essential to work with a qualified mental health professional to determine the most appropriate and effective treatment plan. There should be a treatment plan for managing generalized anxiety disorder. See, individual needs and preferences may vary, and personalized approaches can lead better outcomes in reducing anxiety and improving overall well-being. Here we are, our aim is holistic wellness, the overall well-being, or the holistic health. So, in treating, generalized anxiety disorder, as I said, psychotherapy, particularly the cognitive behavioral therapy, plays a pivotal role. Why? Due to its effectiveness. So, CBT is a widely recognized form of psychotherapy that focuses on identifying and modifying negative thought patterns and behaviors associated with anxiety. So, why is the anxiety caused? We are going into the root cause. I'll also talk about that. The therapist works with the individual to challenge irrational beliefs and develop healthier coping strategies. So, CBT, for generalized anxiety disorder, what it does is, first we identify triggers and thought patterns. So understanding the specific situation or triggers that lead to excessive worry and anxiety is crucial. First, understanding what is causing anxiety is important. Next is, the therapist helps the individual identify these triggers and recognize thought patterns that can contribute to their anxiety. And then cognitive restructuring. See, cognitive restructuring is a method in CBT. Cognitive restructuring is a process that involves challenging and replacing negative and unrealistic thoughts with more rational and balanced ones. By reframing thoughts, individuals can reduce the intensity of their anxiety. See, thought reframing, cognitive restructuring is also known as thought reframing. So, when we reframe the thoughts, the negative or unrealistic thoughts to positive and realistic thoughts, then individuals can reduce the intensity of the anxiety in the individuals is reduced. Next is, as I said, exposure and response prevention, ERP. So, gradual exposure to anxiety provoking situations helps individuals confront their fears. Example, they are worried about, engaging in a social gathering, or giving a presentation, or they are extremely anxious doing that, and they avoid doing that. So what we do is gradual exposure to anxiety provoking, gradual exposure to the situation of going and giving a presentation in a social gathering, whatever the anxiety the trigger may be. So we expose it, and what happens is, and by exposing it frequently, of course gradually, and what they do is, they learn that their anxious predictions are often exaggerated. See, all those predictions are often exaggerated in your mind. Response prevention involves reframing from engaging in anxious behaviors or rituals. So, response prevention is, you are exposing the person to that anxiety trigger, but they are not responding as usual by the worry. So what we do is, we break the cycle of the anxiety cycle of persistent worry. In this way, when the anxiety behaviors are stopped or prevented, that helps this break the cycle of anxiety. So this is the first step, like in reducing or managing anxiety disorder. And then problem solving skills. So, as I said, learning effective problem solving techniques helps individuals approach challenges in a structured and constructive manner. These problem solving techniques now is different for different individuals. It is always customizable, and the major thing is addressing the root causes. What we do is, if we address the root cause, it is easy to wipe it out from the root cause. What is causing anxiety? The same is told in Ayurveda also, to wipe out the disease from its root cause. So, CBT helps individuals explore and understand the underlying thought patterns. What we do is, a therapist and the client mutually sit together, and we, while talking and history taking, we just extract the root cause. So, then what we do is exploring and understanding the underlying thought patterns and beliefs that fuel their anxiety. By identifying these root causes, they can work towards long term change. So, and then teaching coping strategies. The strategies are different for different individuals. What are they? They're like CBT equips individuals with practical coping skills that can be applied in various situations. By learning to manage anxiety through healthier behaviors, individuals gain a sense of control over their thoughts and emotions. So, empowering individuals. Next is CBT. What it does, it empowers individuals to take an active role in their treatment. See, for every therapy, talk therapy, or CBT, or any other psychotherapy, the active involvement of the client is also required. Not only the therapist, but also this is a collaborative effect. So, collaborative effort. By learning techniques to challenge negative thoughts and engage in problem solving, they develop a sense of self efficacy in managing their anxiety. So these produces the long lasting effects. So CBT, always, CBT, cognitive behavioral therapy, aims to produce long lasting changes, reducing the likelihood of anxiety recurrence after treatment completion. So it is important to note that the best treatment for GAD may vary from person to person, and individuals should work closely with mental health professionals to find an approach that suits their specific needs and circumstances. So the next thing is the case studies. Let's see, I'll give you the three case studies of different individuals and how it is managed. And how, if you have any of the symptoms that I mentioned in the previous session, or if you experience any kind of these which I'm mentioning now, please approach a mental health professional as soon as possible, ASAP. So this is the case. Let's presume our our client is Pear, Pear. So Pear is a 32-year-old software engineer. So who has been experiencing excessive worry about various aspects of his life. He has worry about his job, his finances, and his relationships. What happens due to this? He feels restless and has difficulty concentrating and experiences frequent muscle tension. And Alex now is seeking a professional help and starts a comprehensive GAD management plan. So, in case, what could be the um, anxiety disorder management plan for pair. So हमारा पहले केस स्टडी में हमारा जो क्लाइंट है वो है पेयर। एक फॉर एग्जांपल उनका नाम, सो पेयर एक सॉफ्टवेयर इंजीनियर है जिनको एक्सेसिव वरी है। किस वजह से? उनके लाइफ के वजह से, और इनके जॉब के वजह से, उनके फाइनेंसेस के वजह से, उनके रिलेशनशिप के वजह से अननेसेसरी वरी है उनको, जो रैशनल नहीं है। उनको रोज उस वरी के कारण ही इज वेरी रेस्टलेस, ही स्लीप इज, उनका नींद खराब हो चुका है, कंसंट्रेट नहीं कर सकते, इरिटेबल हो जाते हैं। उसकी वजह से उनको शारीरिक सिम्टम्स भी दिखने लगे हैं, जैसे मसल टेंशन, स्ट्रेन होता है उनको मसल में। वो अभी मेंटल हेल्थ प्रोफेशनल को अप्रोच कर रहे हैं कॉम्प्रहेंसिव एंजाइटी मैनेजमेंट प्लान के लिए। So what happens is, first we start with psychotherapy. As I said, pair begins with CBT, cognitive behavioral therapy, with a licensed therapist. क्या होता है? ड्यूरिंग द थेरेपी सेशंस ही लर्न्स टू आइडेंटिफाई हिज एंजाइटी triggers and thought patterns. He realizes that he tends to catastrophize situations, imagining the worst case scenarios. सो ड्यूरिंग थेरेपी सेशंस उनको उनके ट्रिगर्स के बारे में पता चलता है, क्यों उनको एंजाइटी हो रहा है। उनको ये पता चलता है कि वो अननेसेसरीली वर्स्ट केस सिनेरियो को इमेजिन करके मन में वही बैठा के हमेशा उनको उसकी वजह से कंसिस्टेंटली वरी होता है। पता नहीं मेरा जॉब का क्या हो जाएगा, पता नहीं मेरा लाइफ का क्या हो जाएगा, पता नहीं मेरे पैसों का क्या हो जाएगा, पता नहीं रिलेशनशिप्स का क्या हो जाएगा। ऐसे ही द थेरेपिस्ट गाइड्स पेयर थ्रू cognitive restructuring exercises is making him realize that these worries are irrational, helping him challenge and replace these negative thoughts with more balanced and realistic ones. कुछ केसेस में मेडिकेशंस दी जा सकती है। वी आर स्किपिंग द मेडिकेशन पार्ट बिकॉज आई डोंट generally use medication without non-pharmacological approach. My approach is always non-pharmacological. So the next is lifestyle changes. Prayer is advised to adopt healthier lifestyle, healthy sleep pattern, healthy eating pattern, and exercises, meditation, mindfulness practices. So what he does is he starts practicing mindfulness meditation and deep breathing exercises to manage stress and promote relaxation. You can start from actually 10 to 15 minutes. 10 से 15 मिनट तक आप मेडिटेशन या माइंडफुल एक्सरसाइजेस या डीप ब्रीथिंग एक्सरसाइजेस को शुरू कर सकते हैं. From this, what happens is you have more control on your anxiety and worry and stress. So this promotes relaxation. So pair incorporates regular exercises into his routine. So whatever it may be, walking, jogging, swimming, dancing, whatever it may be, to improve his mood, or going to gym or doing yoga, whatever it may be, to improve his mood and reduce anxiety. Physical exercise also plays an important role in improving the mood and reducing anxiety. And next is making dietary adjustment, avoiding alcohol, avoiding tobacco, avoiding more caffeine. That is reduced caffeine intake. 1 to 3 cups of coffee is fine. Anything more than that, reduce excessive sugar intake. All these cause and can exacerbate anxiety. That means increase anxiety. So next, what we do is, after all this, what we do is a support network. We tell a pair to open up and share his feelings with the trusted ones, maybe trusted family members or trusted friends. And next, to build a support network. When you go to a therapist, there are support groups, as I said, to share your experiences, your feelings, your thoughts, your worries, and embracing your journey with collective coping strategies. They will share their stories, you can share yours. So they offer understanding and provide a safe space for him to express his emotions. इस तरह से हम, हाँ, सारी मतलब एक फुल साइकिल होता है एंजाइटी मैनेजमेंट का: साइकोथेरेपी, लाइफस्टाइल चेंजेस, माइंडफुलनेस प्रैक्टिसेस, एक्सरसाइज, फूड, द न्यूट्रिशन, and support network. All these we do. I'll explain two more examples. Our second, you know our second client, let's presume this client's name is Strawberry. So Strawberry is a 26-year-old graphic designer who has been experiencing generalized anxiety disorder since her teenage years. मतलब जब से वो 16-17 years की थी, she has been experiencing generalized anxiety disorder. So what is that? She worries excessively about her performance at work and social situations. She often, she what is her worry? She is always worried about her work performance, that it might go bad, or the worried about the worst case scenarios and social presentations. So and about the professional social gatherings. So she often avoids gatherings due to her anxiety. What it does, it is impacting her daily life. She is avoiding her gatherings due to her anxiety. So here, Strawberry's generalized anxiety disorder management plan also involves a mixed therapy. So what we do is psychotherapy, lifestyle changes, support network, all of these. So what we do is, in psychotherapy, a Strawberry undergoes a CBT with a therapist specializing in anxiety disorder. So through therapy, she identifies her negative thought patterns, and including a fear of judgment and rejection. So she is always fear and worried about, she always has a fear and worry about the judgment and the rejection at the workplace, of her performance at work. So what it is doing is, it is hampering her daily life or productivity. The tension or the worry and the anxiety which is persistent, it is disturbing her sleep as well. So the therapist guides her through exposure therapy, so gradually exposing her to social situations, telling her to go and give the presentation, however it may be. You might be rejected, you might lose it, whatever happens, you have to go and give. This is a gradual thing, and providing coping mechanisms to deal with her fear. So if you have a fear of rejection or judgment, you are just facing it and just seeing that, is really matlab, my fear true? Are people really rejecting me or judging me, or they're okay about it? So medication, and again we are skipping the medication part. So lifestyle changes. So we advise Strawberry to implement some lifestyle changes, to enhance the anxiety management. And this, as this is a professional problem, she might also be advised to go to attend workshops on assertiveness training to build confidence and improve communication skills. We can do it. On job skills are also there in the lifestyle changes. And she also likes local art groups, so she joins there, which helps her express herself. She can do whatever, in whatever way she can express herself creatively in and she can express herself. By this means, she can express herself in the work environment, which offers a supportive environment. Next is same, the supporting network. And the Strawberry here joins a support group for individuals with anxiety disorders. This group provides her with a sense of belonging and understanding among peers who can relate to her experiences. They can collectively manage their anxiety by the coping mechanisms and the skills and the therapy provided there. So this is the second case study. So in this way, it is managed. I'll give you another case study of This let's presume this client's name is Pencil. So Pencil is a 40-year-old high school teacher who has been experiencing generalized anxiety disorder for several years now. He often worries, his worries often focus on his family's safety and health. This case is different. How it is different? Because Pencil is worried about the family's safety and family's health. He's always worried about family's safety and family's health. This worry is irrational. अरे मेरे बच्चों को कुछ हो जाएगा, मेरी पत्नी को कुछ हो जाएगा, उनका तबीयत बिगड़ जाएगा, वो उनको इन्फेक्शन हो जाएगा, या फिर उनको चलते चलते उनका एक्सीडेंट हो जाएगा। हमेशा उसके मन में यही चिंता है। सो Pencil's generalized anxiety disorder management plan includes several, like psychotherapy. First, here also what we do is, Pencil starts the CBT here, cognitive behavioral therapy, with a therapist. Then he learns to recognize and challenge his anxious thoughts related to family's well-being. What we do is we sit. I will one day show you what how a full cycle of therapy is done with practical, so you will understand it better. What we do is we help him recognize and challenge his anxious thought related to his family's well-being. So he's always worried about his family's well-being. He's made to realize that his worries are irrational. This is what we have to do, that this worry is irrational, so it is not realistic, it is unreal. So the therapist teaches him relaxation techniques to manage his anxiety during challenging times. And there are some self-care practices. Pencil integrates his self-care practices. He dedicates his time to hobbies such as gardening and reading and spending a quality time with the family. Sometimes what we do is we call the family members and do a group therapy session for the client and the family members, because when they interact, what happens is that he doesn't the client sometimes don't interact with the family members about whatever the anxiety or the worry they have. So we make them interact, and all these gives the Pencil that sense of fulfillment and relaxation when he finds when the person develops new hobbies and spending time with the family here. So Pencil, we sometimes what happens is, in some of the cases, we practice gratitude and journaling, writing down everything, writing down the fear and thoughts. Journaling is very important in managing every mental health disorder. When you write down your fear and thoughts, and when you go to your core belief, then you understand that these fears are unrealistic. So focusing on positive aspects of his life, what are the positive things that are going on in life, rather focusing on what would go wrong, the worst case scenario, focusing on what is going right in life now. So this helps in counterbalancing the worries. So being grateful for whatever you have, rather than worrying of the worst case scenario, that this can happen to family, that can happen to family. Next is building resilience. So in this case, resilience building is important. Like in the previous case, what we did is, the trainings are important, the communication training, the assertiveness training, and trainings in how to communicate is important, was important in those, in the second case, in the case of Strawberry. In case of Pencil here, Pencil attends workshops on resilience and stress management, learning techniques to bounce back from challenging situations. If at all, let's presume, if at all his worry is for real, that his family is in danger. So, what happens is, when he attends the workshop, he will know the problem solving skills, that is, how to bounce back from the challenging situations and cultivate, emotional strength. Next is the support network. So support network is same for everybody. Like pencil confides in his spouse and close friends. First start sharing and expressing yourself. It is the first step in the treatment, that offers emotional support and reassurance during the times of heightened anxiety. If you share something with your closed and trusted ones, it will give you a sense of emotional support and reassurance during times of heightened anxiety. So like this, he can join the support groups, having the anxiety support group, so that she can share their experiences. They can deal with their problems collectively, coping strategies, and in this way their pencil is not isolated. He knows that many people have this problem and there is a solution for the problem. So here what we did is, in each case study in the generalized anxiety disorder management, plans are personalized to the individual unique needs and circumstances. This I have already told you, that it every plan or every GAD management from differs from person to person. It is always customizable. It is the combination of treatments, that is psychotherapy, lifestyle changes, support network, nutrition, and skill development, problem solving strategies, all help the people gain better control over their anxiety and improve their overall well-being and enhance their quality of life. So it's important to emphasize that seeking professional help and adhering to the treatment plan are crucial steps in managing GAD effectively. I hope I could give you a brief, that is how to, in brief, that how is CBT done, how is therapy done, and how do we manage situations. And it is a process. It happens gradually. It may take several weeks of counseling and therapy. But what happens is, once it is long lasting, once you are done with your therapy, next, most probably, if your therapist can identify the root cause and deal with the root cause, next you will not have the a problem. So this is the management of GAD in brief. There ends the GAD. This ends the session. On this note, we are ending this session today. So thank you for staying tuned, and let me know what you think of the session in the comment section below. So thank you and namaste.